Hello everyone, I'm Trâm. I would like to present a study about effectiveness of using a standardization on history taking for nursing students. This is a pilot study. Simulations has been proven to be an effective teaching method. In the current simulation method, it's impossible not to mention standardization. Besides that, communication skills in general and history taking skills in particular have become the basis competency for education and have been seen as the primary criterion in licensing and certification exams in many countries. Currently, there are 5 methods to teach history taking skills, and this study focuses on standardization and peer learning methods. So 2 objectives of this study were to compare the effectiveness between standardization and peer learning methods, and to evaluate nursing student satisfaction, self-confidence, and critical thinking with a standardization clinical encounter. The study subject were nursing students studying at Eton University. Participants in this study needed to meet the following criteria. They were second-year nursing students. They have a clinical exposure, and they agree participated in this study. The quasi-experimental study and purposive sampling were used in this study. Data was collected using identify information form, knowledge test, interpersonal communication skills, and student satisfaction survey. The identify information form included questions on student age, gender, and general point average. The knowledge test contained 12 multiple choice questions using 10-point scale. Interpersonal communication skills contained 31 items consisting of 70 mentions using 5-point Likert scale, and student satisfaction survey, a self-reported questionnaire, contained 3 domains: student satisfaction, self-confidence, and critical thinking, also using 5-point Likert scale. In addition, students in experimental group were asked what thing they like best and what thing they like least when learning with standardization. Students were randomly assigned either to experimental or to control group. Before that, the identified information data were collected, and all students underwent the pretest about history taking knowledge and skills. Then students assigned to experimental and control group participated in standardization-based training and peer learning methods respectively with a same scenario. Then post-testing took place right after training and included knowledge tests, skills tests, even student satisfaction survey from students in experimental group. The standardization scenario in this study was developed with content related to the topic of perimenopause hot flashes. And this study designed a 1-week standardization training course. The results were analyzed by SPSS using descriptive statistics, Mann-Whitney test, Wilcoxon-Saran test, and content analysis were used to analyze student feedback in experimental group. There were 16 students in control group and 15 students in experimental group. In terms of demographics, 2 groups were homogeneous in age, gender, and general point average. 2 groups were also homogeneous in knowledge and skill because there was no statistically significant difference in pretest knowledge and skill of between 2 groups. After standardization encounter, a significant increase was seen in post-test knowledge score of experimental group compared to their pretest, and after peer learning session, the post-test knowledge score also rose compared to their pretest. But experimental group had higher post-test knowledge score than control group, and there was statistically significant difference between 2 groups. The results show that increase were seen in post-test skill score of both groups. But experimental group also had higher post-test skill score than control group. But the difference was not statistically significant. Previous study agreed that both standardization and peer learning are effective in teaching nursing students, and the results of this study also partly prove the effectiveness of these methods because post-test score increased and improved after training or intervention in both groups. However, experimental group had higher post-test score than control group, and this can be explained that peer learning is based on student collaboration and is only effective enough when the student has experience and knowledge in the field being trained. However, the students in this study were just second-year nursing students with limited clinical knowledge, skills, and experience. In addition, students may not be interested in the important responses of their peer, and they may lose focus during teamwork. Based on the limitation or challenges of peer learning, standardization is considered more optimal teaching methods because standardization is carefully designed to create a controlled, safe, and positive learning environment. And students can practice repeatedly and receive up-to-date feedback from instructor and standardization. For the majority of items in this survey, most students either agree or strongly agree what they were satisfied. Especially all students was satisfied with statements, standardizations, scenario provides many useful learning activities. Those results show that most students were satisfied with learning based on standardization. This result was similar to previous studies. Other studies show that nursing students were satisfied with the simulation experience with standardization, which they view as a positive learning experience. And all nursing students agree that standardization is effective for learning. And most of students felt more confidence after learning with standardization. And this result was also similar to previous study. Other studies show that after taking standardization course, students felt more confident before clinical practice, especially the level of self-confidence increased significantly in interacting with actual patients. In addition, students stated that learning with standardization helped them improve their ability to think critically, and they know how to ask more appropriate questions when communicating with standardization. 73% of students stated that standardization methods help them improve their communication skills. They have more opportunities to participate in real clinical scenarios, and it was easier to understand and memorize nursing procedures. Other previous studies also supported this view. However, there were students describe being nervous and anxiety when talking directly to standardization. Previous study, some students expressed their anxiety when participated in standardization scenario, but they agreed and supported this method. So the conclusions from this study were history taking knowledge and skill of nursing students learn with standardization improve more than the group of peer learning students. And standardization encounter increased the overall perceived student satisfaction, self-confidence, and critical thinking with learning. Based on the result of this study, we would like to give some recommendations. As an educator, we should develop and integrate standardization scenarios into the nursing curriculum and develop a recruitment strategy and training plan for standardization. That's all my presentation today. Thank you so much for your attention.